Welcome to the Healthcare Workforce Podcast, brought to you by Espirita Workforce Solutions. In this series, we're talking to the most influential, agile and diverse leaders across the healthcare industry. We'll get an insight into their unique stories and hear their opinions on the future of health and care in the UK and beyond. This week, we're talking to the UK Chief Executive of Priory Group, Rebekah Cresswell. A nurse by training with 14 years' experience within the NHS, Rebekah is an incredibly successful healthcare leader with an impressive track record of senior operational and strategic positions behind her, and she now heads up one of the country's best-known names in the independent health and care sector as Priory's first ever female CEO, overseeing its 300-plus sites across the 4 UK nations. Rebekah, thank you so much for joining us. Thinking back to where your journey began, can you tell us a bit about you? When did you decide you wanted a career in healthcare, and what was it that brought you onto this path?
I grew up in Thailand. I've got a funny accent because I went to an American boarding school. It's just people spend most of their time trying to figure out where I'm from. So it's always useful to say that at the beginning. Came back to England when I was 15 to do GCSEs and A-levels at that time. And I actually wanted to be a doctor, but I missed out slightly on one grade, and I ended up going through that awful thing that students have to do of trying to figure out what you want to do next in like 2 days flat and get on another course. So I ended up on a nursing degree course at the University of Liverpool, and it's just a real example of how fate, what you think can be like the worst thing ever that's happened to you, ends up being the best thing ever. So I've really enjoyed my career in nursing. I've been in health and social care for over 25 years. If you class my 4-year degree that I did, 29 years. So really steeped in health and social care. So I guess I went into the business because I have a passion for helping other people. And I saw that very much in my nursing career. I now work in Priory. I worked in Priory for 10 years now, worked in the NHS for 14 years before that. And I don't look after anybody different than I did when I worked in the NHS. And I see us very much as strong partners with the NHS in providing services to the people of the UK.
And what impact would you say your time as a healthcare professional has had on the way that you do your job today? Do you think it makes a difference compared to someone who maybe doesn't have that experience of being on the front line, so to speak?
That's a very good question. And I don't think, I'm not saying everybody, I think everybody can come from their own rich tapestry to be a leader. I think what I've got that I have from having been a nurse first is I completely understand what it's like to deal with challenges in the face on the front line. People who do those jobs will often give me a little bit more kudos, if you like, that I've actually worked or been in their shoes, so they might listen a bit more. I'm not somebody who's trying to ask them to do something that I haven't considered or understand what it's like to be in their shoes. I think nurse training gives you the ability to talk to just about everybody and talk about some very difficult topics. And I think I've certainly used that in my career. No conversation feels too difficult for me because you sense where that person's at and you try and adapt your conversation from there. So I think being a healthcare professional prior to doing that has really served me well in helping me have my finger on the pulse with how everybody's feeling about health and social care.
And in such a diverse career spanning public and private health and care organisations, what are you most proud of to date?
So, there's so many things that I could name here because I've really enjoyed my career. I think what I'm championing at the moment is care as a career. I really want those people who are a big majority of our workforce. At Priory, for example, carers and support workers make up about 60% of the workforce. We employ about 15,000 people. We could probably employ another 5,000 actually. But I'm working well on my way towards that. But I really want to as a senior leader, promote care as a career. And I think part of that is the real living wage, and I've managed to get that over the line at Priory. So that is the minimum standard we have. Because I remember when I was a nurse and I started earning £12,000 a year when I qualified. I think it was 11,900 and something. And I thought I was so rich because I'd finally got a salary. And I remember when nurse wages were low, and I do believe that it's only since nurses have been paid better that it has helped to professionalize the service and also end up people getting their degrees and things like that. So I believe that is the way forward also for care, so that people can specialize in different areas within a care function without having to change careers. Or, I mean, we've all worked with people who've been wonderful caregivers for 20 years, 30 years, and the richness of what they can do to soothe somebody who's in crisis is just immeasurable. So whatever we can do to keep those people wanting to do that job as a career, then we need to do that.
You're Priory's first female CEO. In your opinion, what action can those currently in senior positions across the healthcare industry take to make leadership roles more accessible and more available for women in particular, but also increasing diversity more generally and tapping into that rich tapestry of backgrounds and experience that you talked about earlier?
From my experience, I mean, my 4-year degree was one of the early days before people did the degree as nursing. I fell on my feet there, and they used to tell us right from the start, you're going to be the leaders of the NHS one day. And you already had that mindset that you were going to be changing the world. You were on a trajectory to be in a senior leader in the NHS. And I think too many times women are not encouraged enough. Maybe it's from childhood, maybe it's through their schooling, maybe it's because they've had different things. So I'm number one, always encourage my women leaders to be all that they can be, and I do make that as one of my strands of what I do. The other thing is that women often have lots of experience, but not as many qualifications to back up that experience. And I encourage all my women leaders to take advantage. At Priory, we have career pathways. And said, if you're settled in your work-life balance, let's throw in a master's degree that you can achieve whilst you're doing that, and we'll pay for it. So many women now have graduated with their masters, people who've been in care or healthcare a number of years. One of my women leaders wrote to me the other day. She said, thank you so much. You encouraged me to do this masters, and I'm going to be graduating this summer. And my dad is overjoyed. That's somebody who never thought that they would get but it backs up what she does on her CV, and that's a springboard to other things. So I think that's, and then mentoring and shadowing. Every year I mentor somebody. We actually do reverse mentoring, and I'm doing a lady called working with a lady called Priscilla at the moment. She's a hospital director, and she gives me insight into her world, and I will also coach her. And we have a very set time. It's for a 12-month period, and then next year I'll do somebody else. And that is all aimed at giving her more confidence. And lastly, I think being flexible. I got my first real senior job when I was actually pregnant with my second son, Oliver. And it was at Strategic Health Authority for Assistant Director of Clinical Quality and Patient Safety. And I think I did the job for about a month and then had to go on maternity leave. And I know my boss at the time was really a bit nervous about starting somebody. But when I left there, actually to come to Priory, I was there a few years. She said, I have never looked back at taking a chance on you. And that didn't make one bit of difference to the value that I got out. And I think she was from a different generation of people who probably would have been stopped from working if they were pregnant. So I think it's about being flexible. I've never let any of my employees down. I've raised 2 sons in the last 10 years as a one-parent family. So I really I'm really supportive of people, and we do it for dads here too. I mean, one of my dads is on the board. He's a one-parent family, and we're going to swap the days round because he ends up that he can't make it on a certain time for travel because he has his children that night. And I think we need to be flexible both ways. So I think you can get such a richness by being flexible.
Talking about flexibility, thinking back to the last 3 years since the pandemic, we've seen so much change in many of our working lives in a relatively short period of time in terms of flexibility, hybrid working, remote working, all being relatively commonplace now. Do you think there's headroom to go still further with some of these innovations?
The pandemic was awful experience for many people, but we know from history, don't we, that awful times can breed innovation. And even though, and I always encourage leaders in our organization and outside, yes, because we're very challenged at the moment with the economy and etc. and workforce, but it allows us to be innovative. And I think the pandemic did that for virtual working, and it really has shown that people can be very productive, but we need to trust our people, that we measure on outcomes, not process, all that kind of thing. And I'm all for that kind of flexible hybrid working. I think we've still got a long way to go, especially in hospitals and care homes actually do shift patterns. I don't know how we get a bit more flexible. I'd love to introduce a shift that is during school hours, for example. But it's really hard to then cover the other bits. But I think we're looking for things like that all the time.
And moving on to our last question for today, what is the biggest lesson you've learned on your journey as a leader within the healthcare industry?
I think there's two, if you don't mind. So one, that healthcare sector is a people business, and we must never forget that. And that's not just our patients, residents, service users. That is the people who do those jobs day in, day out. Because if they're not supported and feel psychologically safe to work in those environments, I don't think people get the care and services that they need. So I put a lot of emphasis into diversity and inclusion, belonging, which is a more sophisticated level of just diversity and inclusion and making adaptation. But do people feel that they really belong in this organization? Can they speak out? Do they feel valued? Do we say thank you to people? Are we nice? Smile? All those things is really learning it's a people business. When you forget that, that's when a negative culture can start to come, or people vote with their feet and leave you. And then the second one would be that health and social care, and I know you're focusing on healthcare, that they're complex adaptive systems, and people often forget that. They think if we just do this, then that will solve it. But you have to constantly evolve and adapt to this complex system that we work in, and then I think you can be successful in what you're doing, but you have to constantly evolve.
Rebekah Cresswell, thank you very much for joining us. Thank you for listening to the Healthcare Workforce Podcast, brought to you by Espirita Workforce Solutions. To hear more in our series of conversations with healthcare leaders, or for more healthcare workforce content, please subscribe to our channel, connect with us on LinkedIn, or visit espirita.co.uk. If you'd like to be featured on this podcast, or if you'd like to recommend someone to speak with us, just drop us a message at letstalk@espirita.co.uk.